Hi everyone, this is Dr. Suvrati
And this is Dr. Dheera.
So in this year, during our fellowship, apart from learning about the various pelvic floor disorders and the reparative procedures, another important thing that we have set out to do is to increase the awareness amongst the general public about these conditions. And in today's session, we are going to present to you a very simplified approach towards one of the most common conditions that affect the pelvic floor, which is the pelvic organ prolapse. Dheera, tell me, what is pelvic organ prolapse?
So basically, pelvic organ prolapse refers to the bulging of the pelvic organs into or outside of the vagina. And these pelvic organs can include the uterus, it can include the bladder, or it can even include the bowel. So what causes this pelvic organ prolapse?
Okay, so basically the tissues that support the pelvic floor, when they become weak, that is what causes the pelvic organ prolapse. This happens usually during the process of pregnancy and childbirth, which more or less every woman goes through. Secondly, it happens as a result of aging and menopause, which definitely every woman goes through.
Yes.
And some people can also have an inherently weak supporting tissue around the pelvic floor, so they are also predisposed to it.
Right.
Other than that, what happens is when we have more pressure in our abdomen, that reflects onto the pelvic floor as well. So that can also cause for pelvic organ prolapse to occur. So conditions in which the abdominal pressure increases, for example, chronic cough, constipation. So these are more or less the common conditions which lead to it.
Right. Okay.
You tell me, what are the symptoms associated with pelvic organ prolapse? What do the patients complain of?
Right. So you can develop a heavy or a dragging feeling in your lower abdomen or in the perineal region. You can feel like a mass which is coming outside of the vagina. And you can also have associated bladder and bowel complaints. Bladder complaints like you can have a weak stream of urine, or sometimes you may feel that you've emptied your bladder incompletely. You can also have bowel problems like you feel like you have incomplete evacuation of stools, and sometimes you need to press on your vaginal wall to clear your bowel. And sometimes what you may need to do is reposit, that is push back the mass inside which has come out to pass stools and urine comfortably.
Okay.
So what are the complications that can develop with this condition?
The general discomfort, if we leave this condition unattended, kind of increases over the years. Another thing is, most importantly, what happens is if there is a considerable amount of mass outside, because of all the friction and the wear and tear, there happen sores on top of that mass. Like what we call that a decubitus ulcer,
Right.
but these are painful sores that form on top of the mass. Other than that, there are urinary complaints, like you said, and these urinary complaints predispose the lady to infection, urinary tract infection, and recurrent urinary tract infection can actually lead to more severe infection affecting the bladder and the kidney.
Right.
Also, these women may have trouble, they may experience pain and discomfort during sexual intercourse.
Yes.
Can this happen in the younger age group as well?
Yes, this can happen in younger women as well. Though most commonly it's seen in women in the perimenopausal age group and those postmenopausal age group. But as discussed earlier by Dr. Suvrati, she mentioned that a lot of times some women may have an inherent weak connective tissue. These women are at a greater risk to develop vaginal prolapse at a younger age. Okay, so can we do anything to prevent the development of pelvic organ prolapse?
So most of the things that we discuss, the risk factors which lead to prolapse, are physiological conditions.
Right.
So in that case, what we can do is we basically need to, and the main reason as to why pelvic organ prolapse occurs is because of the weakness of the pelvic floor. So now we have to concentrate on strengthening the pelvic floor. Like we discussed in the pelvic floor, important thing is we have the uterus. In front of that is the bladder. Behind that is the bowel or the intestines.
Right.
And all these three things, either together or separately, can prolapse out or can come out through the vaginal walls, which is basically prolapse. So we need to strengthen this pelvic floor.
Right.
And for that, we have specific physiotherapy exercises which must be done in order to strengthen it. And this should specifically again be done at the time where we are undergoing the process which weakens the pelvic floor. So for example, during pregnancy and childbirth. So in the antenatal and the postnatal period, doing these exercises is very important. If you've undergone surgery when it is already in that healing stage, in the post-operative period, it is important to do these exercises.
Right.
So we can do things in order to make our pelvic floor stronger, and then maybe the risk will reduce.
Right. Sure.
Like we discussed, we can do the pelvic floor muscle training or the specific physiotherapy exercises to strengthen the pelvic floor.
Right.
That is a prophylactic thing that we are doing.
Right.
what can we do as a corrective procedure, or what is the treatment for pelvic organ prolapse?
Right. For a lot of conditions, there is a conservative management as well as a surgical management. So even for a pelvic organ prolapse, surgery is not the only option for its management. We even have conservative treatment options, like most commonly, which is that of a vaginal pessary. Pessaries come in various shapes and forms, and the most commonly used pessary in India is the ring pessary. So, and when you visit your gynecologist, he or she would recommend to you the size of the size of the pessary which would be best suited for you after she takes certain measurements. So, what is the surgical treatment for this condition?
Okay, so mostly the affected women belong to the older age group where their family is complete. So uterine preservation is not our topmost priority.
Right.
We go in for a hysterectomy. And another thing is that usually, like we discussed, apart from the uterus, there will also be coexisting prolapse of either the bladder or the rectum. So what we do, our preferred procedure is vaginal hysterectomy with site-specific repair. What are the other procedures? What are the other surgical procedures that can be done for these women?
As discussed again earlier, this condition can even occur in younger women, in women who have not completed their family. So in patients like those, we need to preserve their uterus. So there are even uterus preserving surgeries in which these reconstructive surgeries, the organ is put back into its original position, and alongside, if there is the prolapse of the bladder and the bowel, that can also be treated with a site-specific repair. So removal of the organ is not the only treatment, and there are also reconstructive procedures.
Keeping the fertility of the patient intact.
So can this problem recur even after she's undergone surgery?
Okay, so usually after the woman undergoes a hysterectomy, this problem can still recur, and if she has undergone the vaginal hysterectomy for prolapse to begin with, the chances of recurrence are up to 10 to 12%, and this entity is called post-hysterectomy vault prolapse. And if the lady has undergone hysterectomy in the first place for another benign condition, like maybe say the fibroid, in that case the chances of vault prolapse are about 1 to 2%. So what do you do when this recurs?
If it recurs, first thing is do not panic. Meet your gynecologist, because there are even alternative treatment approaches to this, which can again be conservative or surgical.
So the take-home message of today's session is basically to make the general public aware and more mindful of their own quality of life, and that they should seek help at the earliest. Thank you.
Continue to watch this space for more information. Thank you.